Welcome to the Radiology Advances podcast. Today we're tackling a communication challenge that's become unavoidable since the 21st Century Cures Act. Patients see their radiology reports the moment they're signed, often before their doctor has had a chance to explain them.
The paper is Self-Reported Comprehension of Large Language Model-Generated Summaries of Lung Cancer Screening Reports, a vignette survey, published in Radiology Advances in 2026. It's by Juan Serna, Yanan Yu, Jae-Ho Son, and colleagues, based primarily in the Department of Radiology and Biomedical Imaging at the University of California, San Francisco, in the United States.
And the question they're asking is really practical. If we use a large language model like GPT-4o to automatically generate a patient-friendly summary, does that actually help patients understand what the report says? And does it reduce the anxiety of reading it?
Right, because this isn't a theoretical concern anymore. Patients can log into the portal and see 4 millimeter solid nodule, or LungRADS 2S, while sitting in traffic. There's good evidence that the immediate release of results is welcomed by patients overall. But the comprehension gap is real, and it can undermine the patient-clinician relationship.
And there's a second, more specific question layered underneath. Patient-friendly summaries are often assumed to disproportionately help people with lower English or health literacy. But that has not been rigorously measured, especially for something as nuanced as a LungRADS report.
Which matters because only about 4% of radiology reports are written at an 8th grade reading level. So the assumption is that the people who benefit most are the ones who would struggle most with the original. But assumption is not evidence.
Okay, so walk us through how they set this up.
It's a cross-sectional within-subject survey. They recruited 1,815 adults from the online research platform Prolific, drawn from the general U.S. population, with sampling designed to be nationally representative for age, sex, and ethnicity. Mean age 46, and 919 women. Each participant saw 3 lung cancer screening CT reports in fixed order: a LungRADS 1, a clean negative screen; a LungRADS 2S, negative for cancer but with complex incidental findings; and a LungRADS 4B, suspicious for malignancy.
And for each report, participants first saw the original and then saw the patient-friendly summary. So every person serves as their own control.
Exactly. After each version, they answered 2 objective multiple-choice questions, one on the main findings and one on the next steps, plus Likert scale ratings for ease of understanding, confidence in next steps, and anxiety. And they asked about behavioral intent. Would you call your clinician the same day or wait for your next scheduled appointment?
And the summaries themselves were generated how?
GPT-4o, accessed through UCSF's HIPAA-compliant institutional interface. The prompt was refined iteratively, used a few-shot technique with example outputs, was grounded with a chest terminology knowledge base, and ran at a temperature of 0.7 to balance factuality with natural prose. Every summary was reviewed by a board-certified radiologist, senior author Dr. Sohn, before being served in the survey. Each summary generated in 2 to 6 seconds, and the authors note that radiologist edits were mostly for tone consistency rather than factual correction, which supports the scalability argument.
Let's get to the numbers. Did the summaries actually help?
Across the board, yes. On the objective main findings question, the proportion of respondents answering correctly went from 94.8% to 99.2% for LungRADS 1, from 78.3% to 87.2% for LungRADS 2S, and from 67.7% to 81.9% for LungRADS 4B, all p less than 0.001.
So the complex report, the LungRADS 4B suspicious case, had the lowest baseline comprehension at only 67.7%, and the summary boosted it by 14 absolute percentage points.
And the next steps question is even more striking. For LungRADS 2S, only 50.7% of respondents initially identified the correct next step. With the summary, that rose to 63.2%. For LungRADS 4B, it went from 43.7 to 63.7%.
So about a third of respondents still get next steps wrong, even with the summary, for those 2 actionable reports.
Which is a critical caveat, we'll come back to it. But the improvement is real and consistent.
What about the subjective side, the anxiety piece?
Also significantly reduced for all 3 reports, all p less than 0.001. And importantly, that included the Lungrad's 4B scenario. Even when the report is genuinely concerning, the summary brought down the self-reported anxiety.
Okay, but the headline finding of the paper is really the subgroup analysis. Who benefits most from these summaries?
Participants with low self-rated English literacy had the biggest comprehension gain, 0.83 additional questions answered correctly on average, compared to 0.63 for middle literacy and 0.56 for high literacy. That difference was significant at p less than 0.001, comparing low to high literacy.
And the anxiety reduction tracked the same way?
It did. Low English literacy saw a mean anxiety reduction of 0.36 Likert points versus 0.25 for middle and 0.26 for high. Low self-rated health literacy showed an even steeper pattern, a 0.45-point anxiety reduction compared to 0.22 for high health literacy, p less than 0.001.
And these effects held up after multivariable regression?
Yes, they adjusted for age, healthcare work history, and prior personal radiology report readership, all of which mattered in the univariate analysis. After adjustment, self-rated English literacy remained an independent predictor of both comprehension gain and anxiety reduction, and self-rated health literacy remained an independent predictor of anxiety reduction.
This is the health equity finding the paper is built around. If the summaries help everyone, but help low literacy individuals the most, that's a literacy gap closing tool.
And there was a behavioral intent signal, too. After viewing the summary, more participants said they would wait for their next scheduled appointment rather than calling the clinic the same day. That shift was statistically significant for all three reports, and it was largest for Lungrad's 2S, the complex but non-malignant scenario.
Which makes sense. The 2S report is the one that looks scary on paper, a long list of incidentals, but the clinical action is routine follow-up. Clarifying that actually frees up urgent phone lines.
An overall 95.8% of respondents rated the summaries as moderately helpful or higher, with 57% calling them extremely helpful.
So, high perceived value. But the authors also did a thematic analysis of free text feedback, and that's where the unmet needs come through, right?
They used an LLM-assisted coding approach with OpenAI's O3 Mini, then human-validated the categories. Out of 3,213 thematic assignments from 2,501 comments, the two biggest gaps were guidance on next steps and urgency at 28% and risk assessment and prognosis at 27.7%.
Meaning, even with the friendlier summary, respondents wanted more specific direction on how urgent this is and what it means for their personal risk.
Example questions they asked, things like, is 12 months the standard follow-up, or should it be sooner given my smoking history? Or, how likely is it that this is cancer based on the growth? These are questions that require personalization, integrating the report with patient-specific context, not just translation of jargon.
And that's an interesting pivot point for the future of these tools. Translation is solved, interpretation isn't.
Which the authors flag as a direction, integrating LLM-generated summaries with personalized risk context. But they're also very clear that hallucination risk becomes a much bigger concern the moment you move from translation to clinical guidance.
Now, we have to cover the limitations carefully here because this is a hypothesis-generating study, not a clinical validation.
Right. First, the sample was from Prolific, an online platform. These respondents are more educated and more technologically literate than the U.S. average. Only 14.9% self-rated as low English literacy. So the paper's strongest finding, that low literacy individuals benefit most, is based on a relatively small subgroup.
And none of them are actual lung cancer screening patients.
That's the big one. The anxiety being measured here is hypothetical anxiety, what people say they would feel if they received this report. Real scan-associated distress, scanxiety, carries emotional and longitudinal context that a survey vignette can't capture. The behavioral intent finding has the same caveat. Saying you'd wait for an appointment and actually waiting are different things.
There were also some design issues. The reports were presented in a fixed order, so improvement on later reports could partly reflect practice effects or fatigue, not just the effect of the summary.
A counterbalance design would have addressed that. The comprehension questions themselves were also unvalidated. Only 2 multiple-choice items per report. And the English literacy measure was a single self-reported question that hasn't been validated against an objective English literacy instrument.
Finally, the LLM prompt and scenarios are specific. Results may not generalize to different prompts, different models, or different radiological contexts.
But even with all of those caveats, the signal is consistent and the direction is clear. Patient-friendly summaries generated by LLMs improve comprehension and reduce anxiety, and the effect is largest in the populations most likely to benefit from health literacy interventions. Validating this in an actual lung cancer screening population is the clear next step.
Great work that should spur more studies in this space. We're coming to a close of today's Radiology Advances podcast. Thanks to Serna and colleagues for their work published in Radiology Advances. If you found this episode informative or have any other feedback, please rate, review, and subscribe. It helps more people discover the podcast and supports the broader conversation around innovation in imaging. You can read the full article and explore more great content on the journal website. This episode was generated with the help of AI, but all content was reviewed and verified by editor Dr. Luca Salhofer from University Hospital Essen in Germany for accuracy. Thanks for joining us.